we're responding to a call of a 27-year-old female who fell down the stairs. I've got my PPE on. And my scene is safe. The mechanism of injury is the patient fell down the stairs. I have one patient, female. I will call for ALS backup, and I will do C-spine. General impression once on the scene, I see the 27-year-old female laying in the supine position, her arms outstretched, her right leg at an unnatural angle. Hi, ma'am. My name is Marilyn. I'm with the ambulance. What's your name? She is tracking me with her eyes.
Michelle.
Hi, Michelle. And how old are you?
27.
Do you know where we're at?
My house in Salinas.
And then can you tell me what happened? Why'd you call us here today?
Because I tripped and fell down the stairs.
Okay, so the patient is alert and orientated ×4. She's, her airway is open and patent as she's speaking to me. Her breathing seems a little shallow and rapid. So I will apply high flow oxygen via non-rebreather mask at 15 liters per minute. I will check her pulse. Her pulse seems weak and irregular. Her skin is cool and pale but dry. And I see no signs of major bleeding at this time. I will grab a blanket for shock management. And I'll transport this patient right away. I'll take a set of baseline vitals. Her BP is 94/62. Her pulse is 108, and as I said earlier, it is weak and irregular. Her respirations are 26. They're shallow and rapid. So, Michelle, do you feel any other symptoms? Do you feel anything else?
Neck hurts.
Your neck hurts?
And my back.
And your back. Okay, and do you know if you're allergic to anything?
I'm allergic to mangoes and morphine.
And then, do you take any medications?
I take digoxin and Eliquis.
Do you know why you take digoxin and Eliquis?
My arrhythmia and for blood clots.
And you take your medications as you should?
No.
No. Okay, when's the last time you ate or drank anything?
Like an hour ago.
Mm-hmm.
But I also had alcohol.
How much alcohol?
I had a couple shots.
Of what?
Tequila.
Tequila. And can you remind me again what happened?
I fell down the stairs.
Okay, and this is after gathering sample. This is when I start the secondary assessment. My partner is holding manual C-spine. I'll check and palpitate the area for any signs of trauma, which include deformities, contusions, abrasions, punctures or penetrating wounds, burns, tenderness, laceration, swelling, discoloration, instabilities, scars, and crepitus. I check the back of her head. I reach out my glove. I see no blood present. Checking her frontal area. I check her ears. I see some blood coming out of her ears. Check her orbitals. No signs of trauma here. Open her eyes. Everything looks good. Check her nose. Check her face for any signs of deformity. Open her mouth. See no loose teeth. Check her mandible. Her trachea is still midline and there's no sign of JVD. I'll palpitate the chest, check for any signs of trauma. Michelle, can you take a deep breath in and out? I'll listen to her lung sounds, which sound clear. I'll check her abdomen, roll. I feel there's some tenderness. She winces and there looks like there's some distension. I check her genitals. I see no signs of trauma there. I'll check her hips for instabilities. Her hips seem stable. I'll check her lower extremities for any signs of trauma. Michelle, can you stretch out your leg any more than that?
Nope.
No, she can't. Okay, so I'll check this leg. I'll check both pedal pulses. They're both present but weak and irregular. Michelle, can you push down on my hands? You can't push down on this foot over here?
No.
She can't push down on her right foot. And then can you push up? Can you tell me which toe I'm holding at least?
My big toe.
Your big toe. Okay, so she can tell that. Then I'll go back up to her upper extremities. I see no signs of trauma. No signs of trauma. No signs of trauma. I'll check her pulses. They're both present but irregular and weak. Michelle, can you grab my fingers? Good. And can you let me know what finger I'm holding?
My thumb.
Your thumb. Good. So on the count of my partner holding manual C-spine, I will turn her towards me. Michelle, does it hurt when I move your arm this way?
My elbow.
Your elbow. Okay, she's got soreness on her elbow. At the count of my partner, 1, 2, 3. I check the cervical spine, thoracic, and lumbar. I see no signs of trauma at this point. There's no rectal bleeding present, so we slip in the backboard, and at the count of my partner holding manual C-spine, we will lay her back on the backboard. My partner will put her head into a head cradle, and then we'll strap her in. There are no secondary injuries that I need to assess at this time. And I will assess this patient every 5 minutes. I'll check her BP, her pulse, and her respiration rates as we're en route. And then once I meet with ALS, I'll let them know what I know about this patient, which is the 27-year-old female. She had a few drinks and fell down the stairs after tripping over something. She has allergies to morphine and mangoes. She takes her digoxin and Eliquis, but she's not compliant. Her BP is low. Her breathing rate is fast but shallow. Her pulse is rapid and irregular. I applied high flow O2 via non-rebreather mask at 15 liters per minute and applied a blanket to manage possible shock. And that's it. Good.